Today's presentation will be on the bones of the cranium and face by Garry M. Himes II, Certified Athletic Trainer. Today's class is taught as a human anatomy class for high school students that have either little knowledge or very limited knowledge in their understanding of the musculoskeletal system. This presentation is being taught in such a way that the student has no knowledge. So this may be a little mundane for some of the higher level students, but I do teach high school, and this presentation was developed with that in mind. Now, I do not currently teach a human anatomy class, but this is a class that I would hope that we could get in the future for the high school students. So our learning objectives today will be to identify and name the bones of the cranium and face and describe their locations. We'll also discuss how many bones make up the cranium and what exactly is the purpose of sutures in the skull. Why is this important? Now, I teach all types of medical professionals, students who want to be CNAs, pharmaceutical techs, EKG technicians, athletic trainers, certified personal trainers. So I have a wide variety of students in my classroom that that have some levels of interest in medicine. Some have aspirations of being physicians. Some are going to be happy with being CNAs. So all medical professions must have some knowledge of the cranium and facial bones in some way, shape, or form. And as I previously stated, this information is the last section needed to complete the skeletal system. The students were started at the bottom, their feet, and worked our way up through the lower extremity, pelvis, rib cage, spinal column, etc., up to where we currently are now, finishing up the cranium and skull. Discussion of the cranium and face. What are we exactly going to talk about today? So we're going to discuss the cranial bones, what they are, where they are. The cranial structure, sutures, what exactly are the sutures, and how does your body deal with those? Facial bones, some major prominent facial bones, and then we'll discuss some other structures as well as it relates to the skull and face. The cranial bones that we're going to be discussing are the parietal bone, the frontal bone, the occipital bone, the temporal bone, and the sphenoid bone, and exactly where their locations are in the body. This is a lateral view of the skull and cranium, and you can see that this picture is a nicely color coordinated picture that helps kind of really separate the bones as it relates to learning, so it kind of makes it a little bit easier on the student side. I like to use these colored types of photos, or even have the students take a blank picture and color themselves, which is kind of nice. So you can see as we are here, we have the parietal bone up in the upper right hand corner, which is a bluish color. We have the frontal bone, which is up in the upper left corner, which is a yellowish color, otherwise referred to as the forehead. We then have the occipital bone, or the base of the skull. That's where we'll have some other bony prominences as we move forward, focusing on the occipital area. We have the temporal bone, which is right where your temple and ear kind of are together. Again, we'll have some other structures. We'll just be discussing some other structures with the temporal bone as we move forward as well, and the sphenoid bone. Now, there are some other noticeable structures on here that we will discuss in the future, but at this point right now, the main purpose of this picture is just to discuss the cranial bones. And the sphenoid bone, again, in the very front. So the facial bones. Now, again, keep in mind as these students are first-year students with anatomy preparing to go off to college, hopefully. Again, we're just going to discuss the major bones. So we'll discuss the nasal bone, the zygomatic bone, which we'll refer to as the cheekbone, the maxilla, which is the top of the jaw that holds the top of the teeth and that holds the top teeth and the hard palate, and the mandible, which is the movable bottom part of your jaw that connects to the temporal bone, which through the temporal mandibular joint. Again, as you can see here, we have the parietal bone up in the upper left-hand corner is a pinkish color on this slide. The frontal bone, again, is a yellowish color, which we get a really nice view of that. The sphenoid bone, again, is a purplish color, which you can kind of see just to the left behind the left and right behind the eye sockets there. The temporal bone, which is on a bluish color. But what I would like to focus on here are the nasal bone, which you can see right in dead center of the screen is a kind of a whitish color. The zygomatic bone, which is on the right side as well. Obviously, it's on both sides, but the labeling is on the right side for this one. It's kind of a greenish color, which kind of the cheekbone area there and the part of the orbital socket. The maxilla, which is the top part of the bone, the top part of the jaw, which kind of encompasses the nasal bone and the nose area, as well as the orbital area. It also holds the top teeth in place, as well as the hard palate. The mandible, which you can see on the bottom here, is the bottom part of the jaw, which is the movable part of the jaw, and that is connected to the cranium and facial features, or the face via the temporal mandibular joint, which we were able to see earlier. The cranial sutures. Okay, now I'd like to discuss a discussion question with you. Now, since students have computers, since they already you have your computers out, I'd like you to discuss where the bones come together in the skull are called sutures. Why are they not called joints? We discussed earlier in the lectures that where bones come together are held together by ligaments. So do ligaments really attach the skull bones together? If not, what exactly does keep them together? And we'll work on that. And I would normally give the students about 5-10 minutes to work on that and let them work in partners, since that's kind of a two-tiered, 2 or 3 tiered, very involved process. Some students will find it very quickly. Some students will struggle with that. The cranial sutures. Again, as we've looked at the 2 previous slides of the skull, these slides are adult bones, adult skulls. This is more of a young child, maybe preteen skull, late toddler, as it refers to the closures of the skull. You can see the blackened areas there in the center, or the fontellas, which are referred to as the soft spots, are not quite closed yet. So what I'd like to focus here on the names of the sutures. So we'll start on the upper right, the metopic suture, which holds the frontal bones together. The coronal, just below that, holds the parietal, or brings together the parietal and frontal bones. The sagittal suture, which is right down the center of the skull, holds together the parietal bones. And then lambdoidal suture, which holds together the parietal and occipital bones. There is one more suture that I'd like to discuss, which is called the squamous, which we will go over that on the next coming up slides. So to put the cranial sutures into words, metopic is a suture connecting the frontal bones, in the front part of the skull. The coronal suture, which is the suture connecting the frontal to the parietal bone. Again, one on each side. The sagittal suture, which connects the suture connecting to the parietal bones. The lambdoidal, which is the suture connecting the parietal to the occipital bone. And as I stated earlier, we'll also discuss the squamous suture, which is a suture that connects the temporal bone to the parietal bone. Okay, and now we'll discuss the answers to the previous questions. So if we go back, okay, where the bones come together in the skull are called sutures. Why are they not called joints? Well, they're not called joints because they're not held together by ligaments. They're actually, the purpose of the suture is to be able to allow the skull to have some type of flexibility as it comes down the birthing canal. And that that flexibility is the bones are actually held together by a fibrous type of tissue that does allow for some flexibility in there. As the person gets older, very similar to a growth plate, those kind of fuse together and form the joint of the body. So the reason that they're not held together by ligaments is because of this fibrous tissue. They're not really joints; they are sutures, and those cranial sutures allow the infant or the newborn to come down the birthing canal. If I may put in a personal story, the cranial sutures and how the infant's skull can be manipulated never became more prevalent to me than when my son was born. My son was born with a condition called bladder exstrophy, and we spent 8 wonderful weeks down at Johns Hopkins Medical Center with Dr. Gerhardt, and we were able to, during that time, my son was placed in a room where he had an outside window. Well, because it being August and September, the sun always came through that window, and so my son turned his head away from the window. Well, after a couple weeks, they noticed that he was getting a flat spot on the left side of his skull, and it was really kind of neat. They called for an occupational therapist to come in. The occupational therapist came in with a huge block of foam and a electronic carving knife, took some measurements on my son's head, and out of this foam fashioned a pillow that my son slept on for the next couple weeks, and his skull actually did return to normal, which was actually kind of cool how they did that. So the human skull, the infant skull, can be manipulated very easily, and it's important to be able to know that as well. So some of the other significant cranial facial features, cranial and facial structures I'd like to discuss, as I stated previously, there is a hole in the or an opening in the occipital bone where the brain connects to the spinal cord, and this opening is called the foramen magnum. We know that from previous things that foramen means opening. So this is obviously very important, and this is quite a large opening on the base of the occipital bone, where again the brain does connect to the spinal cord. On the temporal bone is the external acoustic meatus, and this opening is for the ear canal. This allows the person to be able to hear. The mastoid process is the next bony structure that we'll discuss, and this is a bony attachment site at the base of the temporal bone, which is where the sternocleidomastoid muscle attaches. And the next lesson that we'll discuss will be the muscles of the neck and facial area as well. So it's important to know where that mastoid process is, okay? And you can kind of see here this reddened area is where the occipital bone opens up to allow the magnum foramen to come into play. On this slide here, again, this is another lateral view, kind of gives us some more of the bony structures that we're looking to get. And you can actually see this is a very involved picture. If you'd like to take a look at this further, we can discuss some things. But you can see over here on the left side, we have the external acoustic meatus. The pink bone there is the temporal bone. Why they just can't keep the color consistent, I don't know, but they haven't. So the acoustic bone right here. And the mastoid process is right here, is the bony outjut. And just as a side note, anterior to that would then be the styloid process, which is another prominent bony feature. The last thing I'd like to discuss are the occipital condyles. Okay, now these are another bony structure on the occipital bones that are very important to the cranium, as well as the function of the, as far as I'm concerned, the function of the body, as we know it. And we've already discussed the atlas, and we've already discussed the superior articular facet. These occipital condyles actually attach to these superior anterior facets, and that's what connects the head to the body. We know that there's very little movement in that atlas because of the dens of the axis, but nonetheless, this is where the skull attaches to the spinal column. So in conclusion, your exit slip today, we'll have 5 minutes remaining in the period. This is what I want you to do on a piece of paper, a full sheet preferably. I'd like you to name 3 of the bones that we've discussed, 3 of the cranial bones that we discussed. I'd also like you to name 2 of the facial bones that we discussed. In your own words, putting things in your own words really helps to solidify it and ensures your understanding what exactly is the purpose of sutures, how they relate to the human skull. And then I'd like you to name 1 other cranial or facial structure that we discussed. Please note there'll be a quiz on the diagrams, the cranial bones, facial bones, and sutures on Wednesday. So please make sure that you study that and are prepared. If you have any questions, please feel free to email me. Just hand me the slip as you exit the door. Thank you, and have a great rest of your day.